I'm Casey Mullen, and I'm going to be running through the lateral thoracic spine x-ray. These black lines back here are going to be playing as our image receptor. We also have a few things over here that's going to be playing as our tray and our cassette tape. So first and foremost, we're going to talk about the gown instructions. So first, we would have our patient in a gown. As a female, we want to make sure that they don't have a bra on or any unnecessary undergarments. As a male, make sure that they don't have a shirt on if they feel comfortable to do so. No thick collars, no belts, thick jeans, anything like that, depending on the region that we're imaging. Artifacts-wise, we don't want to have any jewelry or metal in. If they can remove that, that would be great. Also with dentures, any hearing aids, bobby pins, etc. Anything that could show artifact on our image, we want to be removed. Then for radiation protection, depending on which region that you're going to be taking the image in, you would just protect accordingly. So, for example, a pretty popular one's like the gonad cover, which we're not going to be using here. After that, we are going to go straight into measuring the central ray with our caliber. So with this, we're going to be measuring the patient from axilla to axilla. So I'll actually have the patient raise her arms. And we're going to be measuring this in centimeters. Keep in mind that if you have a number in between, you're going to round up here. So we would measure axilla to axilla. And we're just going to say this is about 30 centimeters. Put your arms down. So now that we have that number, we're going to go into our SuperTech. So since we're doing a lateral T-spine, we would go on the SuperTech, find T-spine lateral, and put the 30 centimeters into the black box. So the black box is for patients that are 12 years and older, so adult patients, and the red box is for pediatric patients 12 years and younger. So once we put that into the box, we're going to put our TCF, or total correction factor, into the SuperTech as well. So with that, it's going to end up being -5 since we are using a 40-inch fast cassette in the Bucky tray today. But it really just depends on which room you're in to accommodate for that mass. Now that we have both our TCF and our centimeters in the front of the SuperTech, we would flip it around, and this is where we're going to calculate for mass. So we would find our KVP on the side. So in this case, we're using 80 KVP, and we would just find and calculate the corresponding mass. So now that we have all of that information, we'd go to the console, and we would put it all into the console. That way that the X-ray knows exactly what technique we're using. From here, alright. So from here, this is when we're going to go ahead and get our cassette and choose a cassette. So in this case, again, we're using the fast cassette, and it's going to be 14 by 17 inches. So we would take our cassette, and we would put it into the Bucky tray. So the Bucky tray would essentially be pulling out. We would put our cassette into the Bucky tray vertically, and since we are doing the patient's right side, so her right shoulder's to the image receptor, we would go ahead and put our marker as right. Okay. And then from here, we would kind of just slide that in halfway, and that just reminds us that we still need to line up the X-ray beam. So we can't expose until that's all done. So now that we have our cassette picked out, we're going to go ahead and do the tube position. So with the lateral thoracic, our SID here is going to be 40 inches. So basically, I would come to the tube and position it 40 inches SID, no tube tilt here. Also, we're going to have the filtration in the lower half of the patient, and then we just need to keep in mind the anode hill effect if it's appropriate or not to use. So once our tube is set up in the correct position, we're going to go ahead and make sure before we collimate the patient in the direct orientation, we're going to make sure that they're in the right position, the central beam is lined up appropriately, and the beam is lined up on the patient appropriately. So we'll just have the patient come. Perfect. Now I'm just going to push them forward a little bit. And we want to make sure that they are lined up in that mid-axillary line in relation to the image receptor. From here, we would come and make sure that the X-ray beam is lined up right about here in the T7 area onto the patient. Also, that cassette's going to be about 2 inches above the C7 spinous process. We also want to make sure that the central ray beam is lined up over here in the Bucky tray too. So, kind of show that. Once all of that is completed, we are going to go ahead and collimate. So when we collimate, basically we're wanting to see 17 inches vertical, and then at least 8 inches laterally or horizontally. So there's little knobs on the tube that we're positioning that we can kind of manipulate into showing that right amount of light on the patient. So like I said, 17 by 8 inches, make sure that's all set up. And from there, we can go ahead and go to the console. So as the patient's walking to the console, we want to make sure that they're not talking to the patient with their back to the patient. You are wanting to watch the patient throughout the entire exposure. So once I'm behind the console, I would then instruct the patient with all their breathing instructions. I would say prep, and then I would ask the patient to breathe in deeply and hold, and then I would say expose. And that's when I expose the radiation. Once I'm complete with the exposure, I would have the patient just breathe and relax. And that completes the lateral thoracic x-ray.